In this videotape, we will cover the use of utility arches and their use in our patients in both the Phase 1 and Phase 2 of treatment. We can greatly improve our results by use of utility arches. The basic design of the utility arch can be described as a 16 by 16 stainless steel arch wire spanning between molar and incisor teeth. The cuspids and bicuspids, or primary molars, are bypassed by the wire. The incisor teeth are engaged by the anterior portion of the arch wire. The anterior step, approximately 4 millimeters in length, is made just distal to the lateral incisor brackets and is made at approximately a 70-degree angle. The buccal sweep is stepped down to avoid the forces of mastication on the wire and to provide a large loop that may be activated intraorally. The posterior step is placed at a 90-degree angle just anterior to the molar tube. The wire is then tipped back at a 30-degree angle to provide activation on the wire of incisor intrusion and molar distal tip back. There is a progressive buccal root torque that is placed on the wire of approximately 45 degrees to place the molar roots under the buccal cortical plate to resist molar extrusion. This action is not available in the upper arch, so less buccal root torque is placed. The distal end of the wire is towed in to derotate the molars and to gain arch length, and to prepare the molars to accept elastic or other force to the hook of the mesial buccal molar. The upper wire does not necessarily need to have the buccal steps, since occlusion on the food bolus does not deform the wire as on the lower. A helix may be placed 3 to 4 millimeters mesial to the upper molar to provide a method to tie back the wire. This action is used when incisor retraction is desired and can be made active by using an elastic ligature from the molar to the helix. In the absence of gingival display, a tip-back bend may not be necessary since incisor retraction may be the primary goal. When discussing the possible uses of utility arches, upper incisor torque and intrusion to improve gingival display is one that first comes to mind. The tip-back bend at the molar will place the wire in the buccal vestibule prior to engagement into the slots on the incisors. If the wire is not tied back, the incisors will intrude, and since the wire is positioned labial to the center of resistance, labial crown torque and lingual root torque will also result. The molar will tip back with distal crown tip, thus correcting a Class II molar relationship. In young children, this action coupled with mandibular growth may be all that is necessary to correct a Class II dental malocclusion. If the utility arch has been cinched back, that is, that the wire is bent flush to the distal of the molar tube, then the torque action on the utility arch will be countered by the molar tip back. The net result will be incisor intrusion and possibly some incisor retraction, and some molar tip back, but less if the wire was not cinched back. If the same wire is actively tied back with an elastic ligature tie or a steel ligature wire, the incisor torque will be overpowered and detorquing of the incisors will result. Even less molar tip back will take place and some incisor intrusion may still result. This setup may be used when the upper incisors are flared and in need of retraction actively. The Class II may be orthopedic, with extraoral force being used to correct the Class II.